How you doing, folks? Hope you're keeping well and everybody enjoyed Paddy's Day and everything is going okay in lockdown. As you can see, I still haven't got a fucking haircut and it doesn't look like I'm going to get one for a while. But anyway, the show must go on. I'm going to talk to you about ACL surgeries, and just because I had a patient in with me today that he had a traumatic injury on a bike where he was hit by a car. One of the ligaments, meniscus, ACL was all gone. He had a couple of scars and kind of abrasions around his leg, which was kind of affecting his healing. He hadn't used leg in a couple of months. Then he went in and got the MCL repaired. He had a graft through his hamstring. And now we're kind of looking at, right, does he need to go for an ACL surgery? So I'm just going to kind of talk to you about the thought process, it's good to consider these things if you're considering going for surgery. So the top thing we want to kind of look at is, right, do I need the surgery? And things that we're going to kind of look at with this is going to be, right, what's your level of function at the moment? And we're going to take into your age capacity, or your age as well, and then your capacity to be able to use that knee to your full extent. And what I mean by this is, if you're 55 years old and you're not planning on going skiing or mountaineering or hiking up and down mountains, or playing sport and multi-direction sports where you need to cut and turn, there is a scope to be able to strengthen that knee back to a level that's going to be acceptable enough for you to be able to do the things that you need to do, but also we're not expecting you to go back changing directions when you're running on a pitch. And that's going to be different to somebody who's 25 or 18 years old who really has a long time ahead of them and they've got another good few years of sporting years left in them, where they want to be able to operate at the highest level. They are two completely different opposite people that we have to take into account. Right, what are they able to do right now? What do they want to be able to do? And does that surgery and the rehab you have to do after it, does that outweigh the benefit of having the surgery or just going along as you are at the moment? Now, people kind of think about, ACL surgeries, just get it done. There's a lot of work to go into an ACL once you have it done. You're talking at least 5 or 6 hours a week just to get that ACL back where it needs to be. And yes, you can do it and you can spread it out a little bit longer, but ultimately you want to be able to capitalize once that swelling comes down after the surgery on getting those muscles back working as quickly as they can do. So what we're looking at is, yes, I do it. What's your function at the moment? What's your quality of life? What's your age? What's your healing capacity? Do you have a good capacity to heal and recover from the surgery? And then we'll decide, right, okay, yes, let's go for the surgery. Let's go and do it. And then you want to kind of decide, right, when am I going to have this surgery? What's the right time to have it in my life? Do I have a break at this point? Do I need to take time off work? Am I going to be able to do it? Let's get it done before Christmas, and then we have a couple of weeks recovery, and then I don't miss any time off work. And then the financial aspects of that is obvious. If you're not going to be at work, you might not be able to get paid. Then is there a break in the summer? If you're a teacher, it might be better to get it during the summer. But also the biggest thing to consider is that, what is that leg like at the current moment? If you look down at your leg, do you notice an awful lot of muscle wasting in that leg? And if that's the case, it would be definitely more beneficial for you to do a strengthening program to try and build up the muscle in that leg. And the reason you want to do this before the surgery is that, let's say, power comes from cross-sectional areas, how big your muscle is. So the bigger your muscle is, the more power it produces. If you have a very, very narrow muscle or a very, very skinny muscle, it's not going to produce as much power. After the surgery, that cross-sectional area, the width of that muscle is going to dip an awful lot because you're just not using it, and it's after being cut open. So if you have a larger muscle pre-surgery going in, then that dip after surgery, where that muscle width reduces, is going to be less. So let's say if you have a muscle that's 50 centimeters in diameter against a muscle that's 30 centimeters in diameter, that 50 centimeters will dip down to, let's say, 30, and then it'll bounce back up to 50. But if you have 30 centimeters in diameter and then that dips down to 10, it's going to take you longer to get back up to 50 where you need to be. So that could be the difference of maybe 6 to 8 weeks, or maybe 8 to 10 weeks, depending on how diligent you are with your rehab and how what kind of access you have to a gym to get to where you need to be. So these are all the kind of things that we have to consider, and that's what they mean by doing prehab before you going in for a surgery. The more strength you have going in, the quicker you bounce back from the surgery. I had a lady in there who works as a nurse, and what we did before the surgery was we just built up that muscle as much as we could, and it stood to her. She, like, at 3 months post-op, like, she was doing a lot of things. Like, she was getting strength, she was doing step ups, she had a good bit of balance in it. We had a bit of a dip where we needed to strengthen the ankle because she had a previous ankle injury, and we found out that was kind of preventing the knee from strengthening as much as we could. So yeah, but like, it did stand to her having that good bit of strength coming back into it. Like, so that's the cross-sectional area muscle. Once that's really, really big, then it produces more power. If you have more power, you have more strength, and the bigger muscle you have, then the less dip, the quicker you're going to recover from the surgery. The next thing is going to be your recovery time. Now, people say 6 months for ACLs, but that's only just to get back to a decent level of what your pre-surgery level was like. After that, like, if you're looking at going back on a football pitch and changing directions, you have another at least 3 months ahead of you. And there's studies that kind of say that people that go back to sport before 9 months they have a higher risk of going to re-rupture that ACL, or the opposite ACL, which is quite commonly done, especially in GAA. So with your recovery time, you're looking at least 9 months before you get back to what we call return to participation. So returning to sport is one thing, but actually the level at which you return to sport at is completely different. So returning to participation, right, you're able to play the game, but you're not performing at a high level. Then there's returning to sports. It means that you're going into a competitive environment where you're able to compete at it, but you're not competing at a performance level. And then the last one is return to performance, where you have that leg is firing on all cylinders. It's really strong. You're able to cut, you're able to hop, you're able to land. And they're the things that we kind of want to be able to do, and you're able to do that even if you're being tackled by somebody else. It's nice and easy doing all these little balance exercises, and that leg stays nice and stable when you're in the gym and in a controlled environment. But then you put that leg into a competitive environment, and it has to react 10 times quicker to unstable loads, and it has to react quicker to external forces from other players that's going to be able to tackle it, and that's a completely different ballgame. So you're looking at recovery time, you're looking at 6 to 9 months. The progression through that is generally we look at getting the swelling down as quickly as we can, starting to get that range of motion back into it. Once we get a little bit of range of motion back into it, then we'll start to strengthen it as we improve the range of motion. Depending on where you have the graft taken from, whether it's the hamstring or patella, we'll start to strengthen those areas and work on those tissues so there's no scar tissue build up, and those hamstrings start to fire. After the surgery, like, your brain is just not allowing those muscles to fire because it's still in that protective tone, because you've gone through surgery, you have a couple of different keyholes in there. Your brain knows that something's off, so it switches off those muscles completely. That's why they're all flabby and they don't really want to work. You go to your strength, you go to your strength rate or range of motion, get swelling down, range of motion, strength. But then once you kind of get back onto that running in a straight line, then we start to get into the nitty gritty, kind of fine tuning that knee, because the ability to produce force is one thing, but then the rate of which you produce force, or rate of force production, is what we want to be able to work on as well. And we want to be able to see how well you can control that knee as regards, like, what we call anterior tibial translation, where it is, if you go to decelerate and you go to stop, how much does that knee bend forward before you're at a complete standstill and you're able to push back? So it's like backpedaling. So what we will do is we look at how quickly those muscles will kick in. Strength is one thing, being able to be strong, but then being able to produce that force really, really quickly is a different kettle of fish. And then we want to look at power. So how much power that leg actually produces. So strength is resistance to fatigue. Power is the ability to be able to produce a max amount of power, so lift 100 kg, and then your speed, which is how quickly you're able to produce that force. If somebody's able to lift 100 kg and they're able to lift it in 2 or 3 seconds, but then you have another person that's able to lift 100 kg and they're able to lift it in 1 second, they're going to be more powerful because they're moving the weight quicker at a quicker speed. So these are the kind of things we have to look at. Then we have to look at your landing mechanics, how your leg is able to land and control on itself, and how quickly those muscles, those fine-tuned intrinsic muscles, are going to kick in to be able to stabilize that knee. And also looking at the foot. So the foot is the first point of contact with the ground, which is going to be needs to be really, really strong. They've done a couple of studies with a couple of sevens players, And basically what they did was they just made their calf really, really, really strong, up to the point where it was able to produce force at 5 times body weight. So if you weigh 80 kg, 80 by 5 is 400 kgs. You're not going to be able to reproduce that weight from resistance training in the gym, but you can test it with specific machines that'll be able to give you a reading whereby you kind of go, right, this is where my strength level is at. So if you get that foot really, really strong, it's going to support that knee. Same way as you get those hips really, really strong, it's going to support that knee as well. So they're all the kind of bases that you're going to cover in your rehab. And it's the way that you expose that knee to different movements which is going to reap the most benefits. If you expose it to those lateral movements and those torsional movements and those rotational movements quite early, then you have more chance to be able to learn them. But it's being able to do it in a controlled environment at various speeds, and then being able to do it in a reactive setting, and then be able to do it in a competitive setting. So like, there's stages through it. It's not something to take lightly. It's something that you need to really, really consider. It goes, right, am I able to dedicate 5 or 6 hours a week to get this leg right? And it's about how much you get out of it, what you put into it. It's not just a case, I got surgery, Jesus and grand, I'll go back in the pitch. That's not the way. And talk to anybody that's had 2 ACL surgeries, and they kind of go, look, you underestimate the amount of work you need to put into it. Then ongoing after that, if anybody's had like kind of surgery like that, your leg, unless you're continuously to keep up those exercises to warm it up correctly, that knee is not going to warm up as quickly as a knee that hasn't had the surgery. So you will need to do your own activation exercises, your stretching, and get in your activation work with muscles and around the hips and around the ankle, just to get that leg back in firing in all cylinders, where it needs to warm up so you can get on to do a pitch-based session. And these are the kind of things that you will continuously have to do in order to ensure you get the most out of that surgery, and you don't re-rupture it, and that knee is nice and healthy. And sometimes you'll notice if it's after a long season or after a long break where you come back into it, that leg is kind of dragging along it, you're going to need to revisit those exercises again, just to kind of activate those muscles a little bit more. Will you always have to do this? You probably will have to do it for 1 to 2 years after. Then after that, it might become a little bit more automatic. But yeah, these are the kind of things you need to consider when you're going for the surgery. You want to know, do I need the surgery? What's your functional capacity like? What's your quality of life like at the moment? Do I really need to get the surgery, or am I just kind of going, oh, it's the done thing, I've torn my ACL? Plenty of people have torn their ACL, but they have the functional strength around that knee to be able to function without actually getting it done. And yes, the ACL does heal. Now, the surgeons will have a look at it in the MRI and kind of go, right, how much of this ACL is actually loose? Then they'll look at you clinically, what you're able to do. Are you able to functionally hop, cut, land, run? And you're able to produce force, and they look at the strategy in which you produce that force. So are you producing more force from your calf, or are you producing more force from your hamstring, your glutes, your quads? Jumping is one thing, but then you break it down into landing mechanics. Is that ankle loading too much? Is that knee loading too much? Are you loading your hip enough? If you don't load your hip enough, you're going to overload your ankle and your knee. And this is what I mean by the strategy that you use to produce force. That means that, am I using my calf? Am I using a quad? Am I using a hamstring? Am I using my glutes? And some people will use more quad. Females tend to use more quad than they use hamstring and glutes. And then some males will use more calves than they will when they're if using quads or using hamstrings. And you'll see them, if somebody has big, massive calves but no arse, you see them in cyclists all the time. Their strategy to produce force is that calf is producing the majority of force, and they're not recruiting enough of that hamstring or glute to be able to pedal in that cyclical motion. But yeah, these are all the things that you need to consider when you come down to it. So it's not just a basis of that, let's have a look at the ACL, fuck it, I'll just go get it done. Have a consideration of these things, and yeah, you'll be able to come out with a good question. Having a good chat with your physiotherapist, having a good chat with your surgeon, have a chat with somebody else who's gone through the rehab and understands a little bit more about strength and conditioning. But you will need help after you have the ACL. It's not going to be just get it done and then that's that. Hope that's informative, guys, and hope it just sheds a little bit more light on this decision process when you're going for surgery for a knee. Okay, hope that's well. Enjoy the weekend, and we'll talk to you soon.